Hi, good afternoon from the Combined Ophthalmic Symposium in Austin, Texas. We're pleased to have Dr. Preeya Gupta with us today. Thank you so much for being with us.
Thanks for having me.
Preeya, I'd like to speak with you this afternoon about a really interesting technology that we now have in this space. Can you give us a little bit of an overview about the technology that's available to us and how you use it in your practice?
Absolutely. There are so many new devices out there, diagnosis of MGD, and I think part of why so many patients are feeling, but there's light therapy, there's some mechanical debridement procedures, a new treatment, iLux, and also a new treatment called Tear Care.
I'm wondering if you can tell us a little bit more about these novel treatments, especially iLux. We've been hearing about that quite a bit at this meeting. What is it and how does it work?
Yeah, it's actually a treatment that I've started using earlier this year. It came to market in around May, and it's really a novel device. It's a handheld device, very portable, easy to use, and it's something that you can really kind of titrate the treatment to the patient's needs. So you place a little plate in the inferior fornix. You're able to directly inspect the gland. So there's a magnifier that allows you to visualize the orifice. You then focally heat the lid. And so what's great about this device is you can titrate the heat to patient comfort and also patient needs. And then you can actually focally express the glands. And again, you can customize and titrate that to the pressure the patient needs. But also, since you're directly visualizing the glands, you can actually see if you've relieved the obstruction. So really a novel treatment. It's easy to integrate into clinical practice. I would say that, in terms of patient experience, it's very patient friendly. Patients don't really look at it as like a surgery or a treatment, in a negative way. They really leave with a positive experience.
Yeah, it seems like it's a fairly non-invasive way to approach treatment of meibomian gland dysfunction in the office. I'm wondering, where does this fit in terms of your toolbox of treating meibomian gland disease? Do you use this for every patient? Do you use this in the perioperative space? What kind of patients do you use this for?
Well, MGD, the more effective these therapies are. And so if we're waiting until patients have, and so I like to introduce procedural treatment. There's MGD patients everywhere. And so the patients that I'm published an algorithm or a guideline that really highlights the importance of making a diagnosis of ocular surface disease in our preoperative patients. We know that dry eye and MGD can significantly negatively impact vision quality, but also all the data we're gathering. We put patients through all these tests, and we know that dry eye and MGD can lead to fluctuation in keratometry readings, abnormal easier to implement procedures.
Treatment to offer for people on whom you want to optimize the surface prior to getting biometry readings.
Absolutely.
What about after cataract surgery or refractive surgery? Is this a treatment that you do once and then you sort of wave your patient out?
So, I'm still early in my experience, and I like patients to understand that they don't live in above symptoms, but also, really focusing on keeping their anatomy healthy.
Right. I'm wondering if you can speak to the practice implementation aspect of this technology. For example, in practices who may not have a meibomian gland disease treatment.
It can be a little overwhelming when you're first starting. This fear can kind of keep was very easy because they have a dry eye. Really help you figure out how to integrate treatment, and that you have. And once you've done that, finding the patient, or if you're not screening them with questionnaires, or I like to use my technicians and empower them to help me identify MGD. And so it really is a team approach, and I think that's what makes it most effective, and it gives the patients the best experience.
Well, Preeya, this has been a terrific discussion for us this afternoon about meibomian gland disease and how we can use technology to help us address it. Thank you so much for your expertise.